There is one mistake people make during a possible heart attack that can be more dangerous than the pain itself. They wait. They wait to see whether the pressure will disappear. They wait because they do not want to frighten their family. They wait because the discomfort does not feel severe enough. They wait because they are embarrassed by the possibility of calling an ambulance for something that turns out to be indigestion. And while they are waiting, part of the heart may be losing its blood supply. A heart attack does not always announce itself with dramatic pain or an immediate collapse. It may begin as pressure in the center of the chest, unusual shortness of breath, nausea, cold sweating, weakness, or discomfort spreading into the arm, shoulder, back, neck, jaw, or upper stomach. Sometimes the symptoms are intense. Sometimes they're surprisingly mild. That uncertainty is exactly what makes the situation so dangerous. Today, I want to explain what you should do during the first few minutes of a suspected heart attack, what you should never do, and how to recognize the moment when a heart attack may have progressed into cardiac arrest. This is information every adult should know, especially if you live alone, care for an older family member, or have a history of high blood pressure, diabetes, high cholesterol, smoking, or heart disease. Before we begin, understand one important point. This is not a substitute for emergency medical care. A heart attack cannot be safely diagnosed or treated at home. The purpose of this information is to help you respond correctly while trained medical professionals are on their way. A heart attack usually occurs when blood flow through one of the coronary arteries becomes severely reduced or completely blocked. These arteries carry oxygen-rich blood to the heart muscle. When blood flow stops, the affected area of the heart begins to suffer from oxygen deprivation. The longer that blockage remains, the greater the risk of permanent heart damage, heart failure, a dangerous rhythm disturbance, or sudden cardiac arrest. This is why doctors often say that time is heart muscle. Every minute spent debating whether the symptoms are serious is a minute in which the heart may be receiving too little oxygen. You do not need to determine whether the problem is definitely a heart attack. That is not your job. Your job is to recognize that the symptoms could represent a heart attack and activate emergency care immediately. The first and most important action is to call emergency services. Do not wait for the pain to become unbearable. Do not finish your meal, take a shower, change your clothes, or search the internet for an explanation. Do not call several relatives before calling for medical help. Call emergency services first. In the United States, that number is 911. In other countries, use the local emergency number. Put the phone on speaker so that you can follow the dispatcher's instructions without holding the phone in your hand. Tell the dispatcher exactly what is happening. Say that you or the person with you may be having a heart attack. Describe the symptoms, when they began, whether they are getting worse, and whether the person has a history of heart disease. Do not minimize the situation by saying, "It is probably nothing." Use clear language. Say, "I have pressure in my chest and I am short of breath," or "My husband has chest discomfort, sweating, and pain in his left arm." That information helps the dispatcher understand the urgency of the call. Many people believe it is faster to drive themselves to the hospital. In most cases, this is a dangerous decision. Symptoms can worsen suddenly. A person who is still conscious and speaking may develop a life-threatening heart rhythm within minutes. If you are driving when that happens, you could lose consciousness, crash the vehicle, and endanger other people as well as yourself. An ambulance is not simply transportation. Emergency medical personnel can assess your condition, monitor your heart rhythm, begin treatment, and alert the hospital before you arrive. If your heart stops, they have the equipment and training to respond immediately. If symptoms begin while you are alone, unlock the front door after calling for help, provided you can do so safely. Sit near the entrance if possible. Keep your phone with you. Tell the dispatcher that you are alone, and do not hang up unless instructed. Your next action is to stop all physical activity. Sit down in a comfortable, supported position. A chair with your back supported is usually appropriate. If you feel faint, do not continue walking around the house. Do not climb stairs. Do not try to walk it off. Physical exertion increases the heart's demand for oxygen. During a possible heart attack, the heart may already be struggling to receive enough blood. Continuing to move, carry objects, or walk long distances may place additional strain on the heart. Loosen tight clothing around the neck or waist. Try to remain as still as possible. Take slow, natural breaths, but do not force deep breathing if it makes you dizzy or uncomfortable. Fear is a normal response in this situation. You may notice your heart beating faster, your hands shaking, or a sudden sense that something terrible is happening. Do not interpret that fear as proof that the symptoms are only anxiety. Heart problems can cause anxiety, and anxiety can also occur alongside a heart attack. The presence of fear does not make the physical symptoms less important. Stay focused on simple actions. Help has been called. You're sitting safely. The door is unlocked. The dispatcher knows where you are. These practical steps are more useful than trying to convince yourself that nothing is wrong. At this point, many people immediately think about aspirin. Aspirin can play a role in some suspected heart attacks because it reduces the ability of platelets to form or enlarge a blood clot. However, aspirin is not appropriate for every person or every medical emergency. The safest approach is to call emergency services first and follow the dispatcher's instructions. Do not take aspirin and then wait to see whether the pain improves. Aspirin does not remove the blockage, restore normal blood flow, or replace hospital treatment. Taking it must never delay the emergency call. Aspirin may be unsafe for people who are allergic to it, have certain bleeding disorders, are experiencing active bleeding, have been told by a clinician not to take it, or may be having another condition that resembles a heart attack. The dose and formulation also matter. This is why advice from the dispatcher or a qualified medical professional is important. If you have been prescribed medication for angina, such as nitroglycerin, use it only as your clinician previously instructed. Do not use someone else's prescription. Do not take additional doses beyond your prescribed plan, and do not allow prescribed medication to delay the emergency call. One of the most dangerous mistakes is borrowing another person's nitroglycerin because the symptoms sound similar. Blood pressure can fall sharply in some situations, and certain drug combinations can create serious complications. Another mistake is trying to treat the discomfort with antacids and waiting for a result. Heartburn and heart-related chest discomfort can feel very similar. Both may produce burning, pressure, or discomfort behind the breastbone. A person may even belch or feel nauseated during a heart attack. You cannot safely rule out a heart attack simply because the symptoms began after a meal or seem to improve slightly after an antacid. A heart attack can also come and go. The discomfort may ease for several minutes and then return. Temporary improvement does not prove that the danger has passed. This is particularly important for older adults, people with diabetes, and women, because their symptoms may be less typical. Some people never experience what they would describe as severe chest pain. Instead, they may feel sudden exhaustion, breathlessness, upper back pressure, nausea, dizziness, weakness, or a sensation resembling indigestion. A woman may notice discomfort in her jaw, back, shoulder, or upper abdomen. An older adult may become unusually pale, confused, sweaty, or weak. A person with diabetes may have a less intense pain response because of nerve damage. The absence of crushing chest pain does not rule out a heart attack. Pay attention to combinations of symptoms. Pressure in the chest together with sweating is concerning. Breathlessness with nausea and unusual weakness is concerning. Discomfort in the jaw or arm accompanied by dizziness is concerning. Symptoms that begin during exertion and do not resolve promptly with rest deserve urgent attention. A sudden feeling that something is seriously wrong should not be ignored, especially when it appears alongside physical symptoms. Now, we need to discuss an important distinction. A heart attack and cardiac arrest are not the same event. During a heart attack, blood flow to part of the heart muscle is blocked. The person is often awake, breathing, and able to speak, although they may be in significant distress. During cardiac arrest, the heart's electrical system fails and the heart stops pumping blood effectively. The person suddenly becomes unresponsive and is not breathing normally. They may stop breathing completely or produce occasional gasping sounds. Those gasps are not normal breathing. A heart attack can trigger cardiac arrest, which is why anyone with suspected heart attack symptoms must be watched carefully while waiting for emergency personnel. If the person is conscious, keep them seated and calm. Do not leave them alone unless you must briefly leave to open the door or direct emergency responders. Watch for a sudden change. If they collapse, become unresponsive, and are not breathing normally, the situation has changed. You must begin the response for cardiac arrest. Call emergency services or confirm that someone else has called. Ask another person to bring an automated external defibrillator, commonly called an AID, if one is available. Place the person on their back on a firm, flat surface. For an adult or teenager who has suddenly collapsed, begin hands-only CPR if you are not trained or are unable to provide rescue breaths. Place the heel of one hand in the center of the chest. Place your other hand on top. Keep your arms straight and position your shoulders directly over your hands. Push hard and fast in the center of the chest. Allow the chest to rise fully between compressions. Continue without unnecessary interruptions until the person begins to show clear signs of life. An aid is ready to use, or emergency professionals take over. If an aid is available, turn it on and follow the spoken instructions. The device will analyze the heart rhythm and determine whether a shock is advised. You do not need to decide that yourself. Attach the pads as shown in the diagrams on the device. Make sure no one is touching the person while the aid analyzes the rhythm or delivers a shock. Resume chest compressions immediately when instructed. People are often afraid that they will perform CPR incorrectly or injure the person. In cardiac arrest, doing nothing is far more dangerous. Without blood circulation, the brain and other organs quickly begin to suffer irreversible damage. The person may need your hands to keep blood moving until advanced help arrives. If the person is still responsive and breathing normally, do not perform CPR. CPR is for someone who is unresponsive and not breathing normally. It is also important to understand what not to do during a suspected heart attack. Do not encourage the person to cough repeatedly in an attempt to restart the heart. So-called cough CPR is not an appropriate home response to a suspected heart attack and should not replace calling emergency services. Do not slap the person, pour cold water on them, or make them walk around to stay awake. Do not give them food, coffee, alcohol, herbal remedies, or energy drinks. These will not open a blocked coronary artery and may complicate treatment. Do not place them in a hot bath or shower. Heat can affect blood pressure and increases the risk of falling if the person becomes dizzy or loses consciousness. Do not allow them to smoke to calm their nerves. Nicotine increases cardiovascular strain and is especially inappropriate during a possible heart emergency. Do not spend valuable time checking blood pressure repeatedly. A normal blood pressure reading does not rule out a heart attack. Neither does a normal pulse rate, a smartwatch reading, or a home oxygen measurement. Consumer devices can provide useful information, but they cannot safely exclude a blocked coronary artery. A heart attack requires professional assessment, which may include an electrocardiogram, blood tests, monitoring, imaging, and immediate treatment. I once spoke with a man who delayed seeking help because his chest pressure was not severe. He described it as a heavy sensation, almost as though someone had placed a book on his chest. He was still able to speak, walk, and make coffee. He assumed that a real heart attack would leave him unable to move. For nearly an hour, he sat in his kitchen waiting for the pressure to disappear. Then he began sweating heavily and felt discomfort spreading into his jaw. Only then did he call for help. He survived, but he later said the most frightening part was learning how much damage can occur while a person still appears relatively stable. That is a lesson worth remembering. The seriousness of a heart attack is not always reflected by the intensity of the pain. Now compare that with another situation. A woman in her late 60s noticed pressure in her upper chest while folding laundry. She also felt slightly nauseated and unusually tired. The symptoms were not dramatic, but they were new. She stopped what she was doing and called emergency services. She did not drive herself. She did not wait for her daughter to arrive. She followed the dispatcher's instructions, unlocked the door, and remained seated. At the hospital, doctors confirmed that one of her coronary arteries was severely blocked. Treatment began quickly. Her decision was not based on certainty. She did not know she was having a heart attack. She simply understood that the possibility was serious enough to justify immediate action. That is the mindset I want you to remember. You do not need certainty before calling for help. People often worry about feeling embarrassed if the symptoms turn out to be caused by reflux, muscle strain, or anxiety. But embarrassment is temporary. Permanent heart damage is not. Emergency professionals would rather assess a person whose symptoms turn out not to be a heart attack than arrive too late because someone was afraid of overreacting. Preparation also matters. Keep a current list of your medications, allergies, medical conditions, and emergency contacts somewhere easy to find. Store the information in your phone and keep a paper copy in your wallet or near the refrigerator. Make sure family members know whether you have a heart condition and where your prescribed medication is kept. Learn the emergency number in the country where you live or travel. Consider taking an accredited CPR and aid course. Watching a video can introduce the basic steps, but hands-on training builds confidence and teaches you how to respond under pressure. If you live with an older adult, discuss emergencies before one occurs. Decide who will call for help, who will unlock the door, who will gather the medication list, and who will meet the ambulance. These conversations may feel uncomfortable, but confusion during an emergency wastes precious time. You should also know your own baseline. New symptoms matter. Chest pressure that you have never experienced before is important. Breathlessness that is clearly different from your usual level is important. Sudden weakness, cold sweating, nausea, or upper body discomfort that cannot be explained should not be dismissed. If you already have diagnosed angina, follow the emergency plan given to you by your clinician. A change in the pattern of your symptoms can be significant. Pain that occurs more easily, lasts longer, feels more intense, appears at rest, or does not respond as expected to prescribed medication requires urgent medical attention. Never assume that a familiar symptom is harmless simply because you have experienced something similar before. Let us bring everything together. When symptoms suggest a possible heart attack, call emergency services immediately. Do not wait for certainty. And do not drive yourself unless there is absolutely no alternative and the emergency dispatcher specifically directs you. Stop all activity and sit in a safe, supported position. Keep the phone nearby, unlock the door if you are alone, and follow the dispatcher's instructions. Do not take aspirin before calling. The dispatcher may advise aspirin when it is appropriate, but it is not safe for everyone and must never be used as a reason to delay professional care. Use prescribed heart medication only according to the plan your clinician gave you. Do not borrow medication or take extra doses. Do not walk around, eat, drink alcohol, take a hot shower, rely on antacids, or wait for the symptoms to become severe. If the person suddenly becomes unresponsive and is not breathing normally, treat the situation as cardiac arrest. Call for an aide. Begin chest compressions, and continue until emergency professionals take over. The most important skill in a heart emergency is not the ability to diagnose yourself. It is the willingness to act before you are certain. A heart attack may begin quietly. It may look like indigestion, fatigue, anxiety, or a pulled muscle. It may happen to someone who has never had heart trouble before. It may happen while the person is sitting, sleeping, working, or doing something completely ordinary. Do not wait for the dramatic moment you have seen in films. Real emergencies are often less obvious. Listen to your body. Take new symptoms seriously. Call for help early. The decision you make in those first few minutes may determine how much heart muscle can be saved, how well you recover, and whether you are still there for the people who depend on you. When it comes to a possible heart attack, caution is not panic. It is protection. And sometimes it is the decision that saves a life.